To all women who are experiencing pain, dryness, scar tissue, lack of sexual desire, hormone issues, I've seen several doctors, male and female, and they all told me the same thing. I was experiencing all of these symptoms, and everyone told me I was getting older and that I have to deal with them. That's not true. I tried to tolerate the pain, but it started to affect my marriage and my well-being. I was very unhappy. I knew they were wrong, and I was too young to put up with this. I was going to find a doctor that would help me.
I created the Southern Institute for Women's Sexual Health to help women. Many women suffer in silence. Low sex drive, pain with intercourse are common problems that many women do not talk about. I was inspired because of my work with breast cancer patients to learn more.
I got involved in SWISH because in oncology, more and more we're looking at how we can help people survive after they've been through treatment. And one of the things that happens to a lot of women after they've been through treatment is changes in their body's sexual response. Sometimes it's things that they thought were normal and aren't. Other times their body's just not responding to the way it did before. And SWISH is going to be an avenue for them to explore that and improve their function sexually, which helps their overall survivorship.
The one resounding theme in most of my patients, no matter what they came for, could have been incontinence, could have been pregnancy-related stuff, the one resounding theme was painful sex or low sex drive. But that's not what they told their doctors. That's what they were afraid to say.
What's really funny is that that's the one part of the conversation that they will usually try to avoid or not really kind of go over with you. And so when you ask them, so tell me a little bit about your intimate life, your sex life. How is that? Are you doing okay there? Are you having any problems or anything like that? And I can't tell you how many times we'll get patients that will just, or I'll get a patient that'll just, I can see their eyes just start welling up. And then they realize, oh my gosh, I can really talk about this with her. But what's really cool is when I see them back and they do their follow-up with you and you get to see how much more open and excited and they just kind of blossom as a patient, and you just get that opportunity to see them mature and just come out of their shell a little bit more. And that's just really cool to see as a provider.
Dear Dr. Williams, I wanted to thank you so much for giving me and my husband back something that has been so important in our marriage. I thought it was over, and I was very sad until I started to accept the fact that this is how it was supposed to be, until I talked to you about it and you told me that you had the solution. I was a little unsure about it at first, but once you explained everything in detail, I trusted and believed in you, and of course, the rest is history.
The most important part of getting involved with SWISH is now I had other medical providers, people in the healthcare team that understood sexual dysfunction, and we can work together to help these patients get their life back.
So many women have suffered in silence for so long, and I'm not sure if it's because it was the society or culture and the way they were raised, but we hope as an institution to start the dialogue for women, that they know that it is okay to ask for help, to seek help, and achieve the intimacy and the relationship that they deserve.